We are back. We are back. Eryn's got a model. We're going to talk about
Prolapse. Pelvic organ prolapse. So this is the thing.
Eryn's like our prolapse expert here, so I'm just going to sit back, drink tea, and listen to her.
No, that's not true, but I do a lot of prolapse work. So let's talk about it related to menopause first. So why all of a sudden do people notice they're having symptoms of prolapse as they go into menopause and enter menopause?
Hey, Eryn, what's a prolapse?
So a prolapse is when any of the pelvic organs, so your bladder, your uterus, if you have one, and your rectum, there are some other types, but those are the three that we see the most in office, start to lower into the vagina. So again, your vagina is the tube that connects to the vulva on the outside. It's upside down. But basically what happens, so let's pretend I'm the bladder sitting here at the front. The bladder starts to push on the vagina tube, and we actually sometimes can start to see and or feel the vaginal wall starting to move closer to the opening of the vagina. And actually sometimes can move outside too. So we do see them completely outside sometimes. Patients are obviously terrified when they notice and or feel that. Lots of times they'll present to emergency or present to their family doctor because they're actually concerned that something is going to fall out.
Or they think it's a tumor and they're really scared they've got advanced stage cancer. I see a lot of patients that are really worried about that.
But it's basically your vaginal wall. It's kind of flipped down. And so it's normal sometimes to see too, depending on the type of prolapse and how advanced it is. There can be like almost wrinkles in it, which I think also scares people, but that is your vaginal wall and that's how it should look.
Yeah,
anatomically normal. It's like an accordion. So people are always concerned about that too. So that can happen. I always say I'm simplifying, but there's two main reasons why prolapse can happen. And there's a whole host of reasons why those two things can happen. Okay. So it's not your fault. It's multifactorial. But what happens is that your fascia, so that's all the connective tissue that holds the organs up. That is one really important part in prolapse. And then your muscles, okay? So your pelvic floor muscles also provide support to the pelvic organs. Our big role as pelvic floor physiotherapists are to work on the muscles, okay? Connective tissue and fascia, because it doesn't contract, we don't have as much of a role to play in rehabilitating. Well, we can't because it doesn't contract, okay? There's things we can do to reduce pressure on the connective tissue and the fascia that we teach as pelvic floor physiotherapists, but we have this huge role in muscle function. So obviously, perimenopause, menopause, just like all of our skeletal muscles, estrogen starts to decline. We start to notice changes in skeletal muscle. We start to lose strength in the pelvic floor. So sometimes all of a sudden people will notice, hey, I wasn't having a problem before. I'm starting to have pelvic heaviness. I'm starting to feel something in my vagina because we've lost strength and support from the pelvic floor muscles.
Yeah.
And people say to me sometimes, well, what's more important? And I say it's like blades of a scissor. Right? They're both really important. They both play an essential role in pelvic organ prolapse. But obviously making sure your pelvic floor muscle function is as good as it can be is going to help minimize symptoms, and it's going to help prevent, like when you have changes in intra-abdominal pressure, bearing down into the prolapse, if the muscles can respond appropriately to changes in abdominal pressure.
Right. So what she's saying is that you need support from beneath, right? But also the amount of pressure that you experience from above can increase or worsen symptoms. And that's one of the techniques that physiotherapists use, pressure management in a way, and as a means to try to decrease the symptoms. Yeah. So I think that a lot of women will say that they feel like a bump is down there. They can feel something when they wipe. They're noticing that heaviness or an achy feeling.
Sitting on something.
Yeah, they can feel like they're actually sitting physically on something. Sometimes if they're doing an internal kind of exam on themselves, they'll feel that their cervix is sitting lower than it once was before. Mm-hmm. So those are all the things that we see. And they can be more exaggerated after things like constipation or even just a bowel movement. In fact, some women will say, I can't actually have a complete bowel movement unless I put my fingers inside my vagina or up against the vulva to support the wall that's falling.
And because that supports then, if you put pressure in and you're able to push the wall back up, that's going to create a more optimal anorectal angle so that
the tubes line up a bit better. Yeah.
You unkink the garden hose.
Yeah. Some women will have difficulties urinating. They'll feel like I pee, but I don't really feel empty. If I lean forward or side to side, more will come out. Or once I stand up, like another significant amount of urine will come out. So those are the big ones that we tend to see, right?
So I think like even if you don't feel like you're necessarily having issues, just having a check-up or a check-in with a pelvic health physiotherapist, we can kind of help optimize and direct so that you can make sure that you are kind of working on your pelvic floor muscle function, because just like other muscles in your body, it's great to be continuously working on them. To have that support and the ability to manage intra-abdominal pressure can be really helpful in our entire life, but also as we age.
Yeah, something to be aware of. All right, that was 5.5
minutes.
Again.
Bye. Bye.